Okay, welcome, Pahrump. This is Dr. Michael Reiner, your host of the Independent Doctors of Pahrump. Tonight is a live show, and I believe the number will come up on your screen, 727-8750, for those of you who are watching this instead of Monday Night Football. I appreciate your tuning into the show. It came to me as of the result of thinking about this that I'm probably going to start a segment on the future shows, which is It Makes You Sick, where I determine or talk about a issue that makes you sick. And then I probably might decide to go on a little political rant on what makes me sick. And that could be with regards to just about anything that involves politics and medicine and things of that nature. I believe that this is a good, and clearly right before they start the show, they tell you that these are my opinions and not the opinions of the station. But it's amazing how I'm out in the community sometimes and I get similar comments, how much people appreciate the show and they appreciate the information that is leveled on the show, and they get insight to things that they probably didn't know. And I'm glad they run reruns when I'm not here, because sometimes with the information that I present, it takes several times for that information to sink in. And with regards to that, it's been one of those things where I've had diabetic patients in my office and I've talked to them over and over and over again, and for just some reason, there is something I say and that gets them on board with what I'm talking about. Hey, I think we have Ray on the phone. Ray.
Hey, good evening. Nice to see you right from the get-go.
Yep.
I mean, you're starting the show. It's not like halfway through you're coming in. So
yeah,
good to see you. And I agree with your new segment you're saying as far as political stuff. I mean, what's going on is completely absurd.
Mm-hmm.
It just seems like somebody's always interfering. We no longer have the ability to just go ahead with our lives. There's already somebody throwing a monkey wrench into it, and it just it's got to stop. It can't keep going. It keeps escalating more and more.
Mm-hmm.
So I'm looking forward to that. My question tonight is about aneurysms.
Mm-hmm.
Well, there's a brain aneurysm, but I've been hearing more about like abdominal aneurysms, and I talked to a surgical nurse in California, Sylvia. You know Sylvia, she used to be home health care out here.
Uh-huh.
She said that she's seen the operations where sometimes they're like bypassed. They go around the aneurysm instead of cutting it out. It's very dangerous. If you could explain what an aneurysm is, and if there's some way to prevent it, which I don't believe there is, and I'd appreciate it, because I have very little knowledge of this. And I always like your show, Doc, and when you show up on time, I like it even more.
Thanks, Ray. I actually had a pretty light day at the office today, which is kind of unusual. I think it was a scheduling faux pas. But that being said, that allowed me to get out of the office at a decent hour and be here on time. And certainly I like being here for the full segment. And I love the fact that you call in. You ask very interesting questions and very good topics. And, for the public's knowledge, Ray, I never know what Ray's going to say. So I always get a little nervous when he calls, hoping that I have the information that he wants. And sometimes I do. And if I don't, then I just say, well, I'll research it and I'll get back to you, like valerian root and things of that nature. With regards to aneurysms, a very interesting problem. Cerebral aneurysms or brain aneurysms are defects in the vessel wall, and they are entirely different. They're called Barry aneurysms, and they are entirely different nature than the abdominal aortic aneurysm, or what we call the AAA, which is what you were alluding to. And Barry aneurysms or brain aneurysms are very scary issues because people just really don't know that they have them. And all of a sudden they may rupture on any given day, and people get extreme headaches, and then there's such a controlled pressure, an inability to release the pressure in the brain, and people die very rapidly from a ruptured aneurysm in the brain. A family history might be your best way to see if you are at risk of a Berry aneurysm. And there are also, with regards to aneurysms in the brain, there are also what they call lacunar infarcts, where you actually have high blood pressure that narrows the blood vessel. And then you have subdural hematomas and bleeds that usually occur from trauma, and they can be just as deadly as a Berry aneurysm. The key to that would be that you're over the age of 75 and you have any type of closed head injury, or maybe even 65, you're extremely at high risk for developing cerebral bleed. So I think we can close the book on that, and if there was anything in that information that sparked another question, then you can call back in. But with regards to AAA abdominal aortic aneurysms, those are definitely some things that people usually pick up incidentally. If an aneurysm ruptures, an abdominal aortic ruptures, you're usually dead within 30 seconds because of the amount of blood that will fill into that area. The good news is they're really detectable and they're really easy to pick up. An abdominal ultrasound will usually pick those up, and places like Life Screening and places like that do that type of study. And if you don't have an insurance policy, might be a cheap way to get a screen on that. But they usually occur in the elderly and elderly males, and certainly it's an atherosclerotic vascular issue. Atherosclerosis, or hardening of the arteries, is something that happens as we age, and it is an age-related phenomenon. And since the aorta is normally of a caliber of about 2 centimeters to 3 centimeters, 2.5 is probably the average size. So basically a 2.5-inch pipe going down in your abdomen. And over time, of course, atherosclerosis develops, and then the body, as you injure the lining of the blood vessels of your body, you will develop some ulcerations, and then your body tries to heal those by laying down calcium. So an atheromatous plaque or cholesterol deposits in that aorta, they may rupture, but they're not of the caliber that cause a heart attack. And the reason we have MIs, the same process takes place in the aorta as it does in the coronary arteries. The problem with the coronary arteries are they're very narrow blood vessels and under high pressure. So if you take a 2-inch lesion and you try to block it off with a big plaque, it's almost virtually impossible. I mean, it can happen, but if you take a 3 millimeter, 5 millimeter artery, maybe 6, and you develop some plaque in there. So it doesn't take a lot of plaque in a coronary artery to make a difference in the amount of flow. So you never really will develop symptoms of plaque development in your abdominal aorta. And they are stress related. I say this study quite often. You don't necessarily have to be a drinker or a smoker or have a lot of cholesterol in your system to develop atherosclerosis. Unfortunately, during times of war, when you have GIs that have expired in the course of battle, there are autopsies performed, and these are young people, age 17, 18. And of course, the meals that they ate were probably high in fat, but they had significant atheromatous burden in their abdominal aorta just due to the amount of adrenaline and stress that they were under at the time of battle. So that could be one factor. Obviously, excluding that particular issue, talking about smoking and high cholesterol meals and diabetes and other things are going to place you at risk of developing atherosclerosis of your arteries, all arteries, whether it be in your neck or in your heart. And because the aorta is under such high pressure, if you develop a significant hardening of the arteries and the plaque develops a hard thing, and then all of a sudden there's a crack in that plaque, then the pressure of the blood will actually go inside and start to separate the arterial wall. And that's the development of an aneurysm, meaning the actual atherosclerosis, it just cracks. It's like your hands, they just peel and they crack, and then it gets underneath the skin, and it starts to develop a lining and a little bit of that. So that's the process that starts that particular issue. So those people that are diabetic, those people that smoke, those people that have had any type of heart disease, a cholesterol-related disease, if they've had a stroke, these are people that are also at risk of developing aortic aneurysms. And there are, unfortunately, aortic aneurysms that develop people that don't have those other things. And we're going to be going to break in just a few minutes. We'll come back and we'll talk a little bit more about the diagnosis and then the treatment thereof for those aneurysms. So when we come back, we'll pick up that subject. Thank you for tuning in tonight. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.